Thank you everyone for providing your information, and glad to see a lot of you are here from all parts of Indian country supporting your communities, youth in your communities, and your on a larger scale. So thank you all for your introductions. And so going to next slide, please, Mindy. As I mentioned, my name is Sabu Kirimjian. I am the Public Health Associate at the National Council of Urban Indian Health. Next slide, please. Today's community learning is titled Weaving Calm, a strength-based approach to addressing stress amongst Native urban youth during COVID-19. And this is session 3 of our three-part session. And really, this series is focused on promoting mental wellness for urban Native youth, and providing support for urban Indian organization staff, leadership, and uh, our tribal partners with comprehensive view and the extent of suicide, substance use amongst this group, strategies of addressing concerns through clinical treatments and special considerations on the impact of COVID-19. And that's kind of the purpose of our series. And so wanted to just share that with you, with all of you. Next slide, Mindy. A little bit about Nakui. As maybe some of you have already know from the work we do, but we are a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. Um, we, on a larger scale, we support Title V urban Indian programs through the Indian Health Improvement Act, and we're also here really to support our tribal partners too, because we're all connected in some way in the work we do for native communities across Indian country. So next slide, Mindy. So I wanted to just go over the agenda before we start. I will be doing some housekeeping, talking about some Zoom housekeeping that all of y'all, just a little bit some information about today's community learning, and then introducing our presenter, Dr. Mary Swick. And at the end of today's presentation, there'll be a discussion and brief Q&A uh, that Dr. Mary Swick and us will be helping with. And then just asking everyone about being able to take our survey and some upcoming events that everyone would like to share, to see if you want to share with your communities. So that's a little bit about the day of how this next hour is gonna go. So next slide, Mindy. So housekeeping. The webinar is being recorded. All mics are muted unless otherwise directed. Please, if you can, turn on your camera if you're able to allow for interactions. The session is an hour. Questions can be typed in the chat box. There is a Q&A that be offered, as I mentioned, in our agenda, and then the slides and recordings will be available for today's session, but also all our previous sessions. So it's really a good hub for anyone who wants to see what we had presented on in the other two sessions and in our other series around promoting mental wellness for Native youth. So, and then there'll just be an evaluation, a really brief one, to get your feedback on how we could better improve, and other topics that you all think would be helpful for us to go ahead and present on in the future. So thank y'all. Next slide, Mindy. Just a quick like overview of, like, if for those who don't know, I think we're been in Zoom now for like over a year. But if for those who don't know, by if you want to ask a question, click on the chat box and type in your question. We will be making sure to look over the questions that you asked in real time as Dr. Swick presents, and um, we will either have Dr. Swick will either be able to will answer it at that moment or in towards the latter end of today's session. So, but we will not. We were keeping track of your questions, so it will be asked. Just to let you know. So if y'all want to type it in. Next slide, Mindy. And then we will be having a portion of today's session. There will be some polling questions asked using Poll Everywhere. I will put the link in the chat box as Dr. Swick presents, so people could closer to the polling, y'all could click on that link and just answer like open-ended questions that we have for everyone. And the way you could either do it by the link that I'll provide to you or text it, text Wired Sun 334 to 22333, whichever one's easier for y'all. I'm gonna definitely have the link there in the box if you just want to use the computer. Next slide, please. And without further ado, I would like to introduce Dr. Swick. Dr. Mary Swick is a licensed psychologist and associate director and associate scientist at the Center for American Indian Health in Johns Hopkins School of Public Health. She has a joint appointment in psychiatry at Johns Hopkins School of Medicine. Dr. Swick completed her BA in psychology, philosophy from Johns Hopkins University, in clinical psychology from Southern Illinois University, and postdoctoral fellowship in Johns Hopkins Division of Child and Adolescent Psychiatry. Dr. Swick has conducted research on substance use and trauma, focusing on preventing Native American mental health disparities for over 10 years. Her research in collaboration with White Mountain Apache tribe has helped to identify unique risk factors impacting these disparities, the importance of protective factors, including cultural identity, promising interventions associated with reduction of in the Apache suicide rate. And in Maryland, Dr. Swick has led efforts to implement suicide screenings within Johns Hopkins Health System, including the Pediatric Emergency Department, all inpatient units in the Children's Hospital, and Kennedy Krager institution, as well as the University of Maryland's medical system, resulting in over 1,000 youth screened to this date. There's a lot of other things that Dr. Swick has done, and I just wanted to share a little bit of that and want to give the mic now to Dr. Swick and honored for her to be here today.
Thanks, Sabu, for that introduction. That picture you saw of me, welcome everyone. I'm so honored to present today. That picture you saw of me is a little bit of a fun picture on the previous slides. That's a picture of me on the White Mountain Apache Reservation that Sabu referenced, that I've done a lot of my work. And there's a youth run cafe with their art, and that's a picture of me outside there. So again, I'm really honored to talk to you guys today about stress and how we can weave calm into all our lives and help the young Native youth that we work with during this really turbulent time. And I'm hopeful that today's presentation will just have a lot of practical skills. Some of the things you guys will already know, some will be refreshers, and some you'll learn some new skills today. And again, I'm really excited to have you guys answer the poll questions and have a great discussion at the end. So next slide, Mindy. Thank you so much. So our hope, we have a lot we're hoping to accomplish today. So our first goal is we're hoping to recognize behaviors associated with stress in Native youth. And really these are going to apply across a broad range of youth. We're also hoping to understand the negative impacts of stress on our behavioral and mental wellness with a focus on suicide and substance use. We're also hoping to really think about how stress is intensified specifically for Native communities during COVID-19. And these first three bullets, I'm hoping to go through a little more quickly during the presentation because I really want to get to that strengths-based focus at the end, where we really talk about different interventions and coping strategies that we all can use and share with our young people. Next slide. So first of all, what is stress? It's important for us to really, we use this word for everything these days. We ask people how they feel. It's stressed out, stressed out. We have to think, what does that really, really mean? So it's good for us, for our own selves, to think about it and to encourage the young people that we work with to really think a little more concretely about it. And there's good news about stress and there's bad news about stress. And so you might wonder what could possibly be good news about stress, but a little stress is a good thing. Almost like anything in life, like balance is good, right? So a little stress can help us do well on a test, right? It might make us say, oh, I'm a little bit stressed about that test. I'll study a little harder. It could help us prepare for a presentation. So like if I was a little stressed about today, maybe I would have looked over my notes a little bit more ahead of time. So if those are some ways, or if you're an athlete, right, a little bit of stress can help your performance. But we know the bad news is when there's too much stress, it really has a lot of impact on our physical health, our mental health, and our relationships. And so that's really what we're going to focus on today. We're going to focus on those acute stressors and the chronic stressors that we're experiencing during COVID and how we can fight those. There's another thing we want to kind of be mindful about when we think of stress and talk about it with individuals is that there's short-term stressors and long-term stress. I think we all hoped that COVID would be a short-term stressor, right? But it's starting to turn into a little bit of a longer-term stressor. But I think you guys might know what I mean. There's sometimes little things, and there's actually these daily hassles, which are another thing that we know or can be stressors. So like, for instance, we have like remotes for our cars and say like, you didn't replace your battery. And every day you think, oh, I should replace that battery. And you don't. And the signal goes off in your car. And it's like this annoying little stressor, but you have it every day. Right. So that's an example of a daily hassle stress. There might be, for example, you might be getting ready to get married or experience a big life event. And that could be a short-term stress that you're facing. Our Native youth are also facing long-term stress, right? Racial discrimination and other events in their daily lives that are with them over the long haul. So when we talk about stress, I try to really have young people and myself think about what are my, short-term stresses that I can kind of get through. What are long-term stresses that I need to have a plan to deal with? And what might also be these daily small hassles that really just can accumulate over time for us. We also can look at stress in different domains in our life and different time points. So again, these are all just different ways to think about it and talk about stress and try to make it a little more concrete. So if we could have you think about, like, if they're in school, what are my stresses in school? Or if they work, what are my stresses related to work? What are my stresses related to friends? What are my stresses related to family, health, etc.? We can kind of walk them through different domains in their life and have them think about what are the strengths and what are the stressors. We can also have them think about different time points in their lives as well. So what are some things in their past that cause them a lot of stress that maybe they dealt with really well, and we could reflect on that. We could have them think about anticipated future stresses that are coming. So again, these are kind of different ways to just talk about it. The last point on the slide is really interesting too. So we can think about, we all have different levels of stress that we are used to dealing with and can handle, right? I could, put Mindy and I in the same situation, right? And we could both have very different stress reactions, right? Because we're all really different people. So we all have really different comfort zones of what we're comfortable with and when our limit is reached. And, those of you on the call that are parents, you can know that too. Our kids can be very different in this. So it's really good to help people be aware of, like, what am I comfortable with? When am I stretching my limits? And stretching our limits is good, right? Because it can push us a little bit to accomplish more and do more. But then there's when you're pushing your limits. So we can kind of help ourselves and our young people to kind of identify those different zones for themselves. Next slide, please. So what might be some different signs of stress? So the next thing we want to do is, once we have young people and ourselves kind of really understand some of the things on the previous slide, it's really good to have some self-identification and think about what our different signs of stress are. And we can break these down into a couple of different categories. And this isn't necessarily all inclusive, but there's some behavioral signs. And these are signs that we can usually observe or see in other people. So, for example, some people, when they're stressed, they might get kind of really jittery or kind of wring their hands or like pick their nails or pace, right? There's different things. We could all even think in ourselves, kind of like what we do. We could also, this is a big one, we'll have changes in our mood and our patience level. So, like for me, for example, I can tell when I'm getting less patient with my coworkers or with my children or my family members. I'm like, okay, wait a second. I'm probably not handling my stress now really very well, or I must be experiencing some extra stress more than normal. So again, these are things we can all kind of tune into. For other people, it's more social, their behavioral signs. So when they're really stressed, they may be more likely to withdraw from others around them. And that could be an example of a warning sign for them. Then we've got more of our physiological signs. And again, you might think these are, there's could be some overlap between how we think about these, but these are the ones that are really affecting our body. And so often we'll have maybe more aches and pains, or we'll have certain spots in our bodies where we feel tense. A lot of people will feel it like in their neck, shoulders, and back. In addition, we may have sleeping or eating problems, and it can kind of go either way, which is really interesting. Some people sleep more when they're stressed, some sleep less. Some eat more, some eat less. Again, we're all kind of different. But these are good probes that we can kind of use with young people to examine for themselves their own signs of stress. Next slide, please. The other thing we really want to think about when we think about stress is, what are the stressors? And we can have folks kind of use these prompts to categorize different stressors for themselves. So we have what we might think of as external stressors in our lives. These could be people that tend to stress us out or make us feel stress. Could be certain situations that we're in where we get stress. And for some people, that could be new or unfamiliar situations. Or it could be certain places. Some of the youth that you guys work with will have experienced trauma. And so if there's a certain place that's associated with trauma in their lives, going to a similar kind of place, again, could be re-traumatizing for them and bring more stress in their life. So we can kind of walk through and think about this for ourselves and for the young folks that we're working with. And these are usually easier for us to identify. The next category is our internal stressors. These can be a little bit harder for us to kind of think about. These can be thoughts that bring us stress. So it's really trying to be aware of that dialogue in our mind. So maybe if it's, for COVID, we could think about, what are the thoughts that go through our mind about COVID or this situation that bring us more stress? It could be, I don't know when this is ever going to end and if we're ever going to get back to normal again. So maybe if folks are having those internal thoughts, that could be, and it's not an unrealistic thought to have. I'm sure we're all having this this thought off and on, but to kind of be aware, if they keep thinking that thought and that's increasing their anxiety, that would be important for them to think about. It could be a mental image, right? So maybe if they had a loved one who was really sick with COVID or passed away, and they're kind of having these memories and images in their mind, or they see similar images on the news, that could be stressful to them. So again, we're just kind of looking at stress from all these different angles to be able to talk to youth in a really well-rounded way to have them really become self-aware. And so we're going to pause here and we're going to go ahead to our first poll question. And I know it's going to go off without a hitch. So Sabine's going to help us and Mindy do that.
Yes, Mindy is prompting the poll everywhere question right now, and I actually put the link in the chat box if for those who just want to press on the link and answer this open-ended question, or you could text Wired Sun 334 to the number 22333 to provide your feedback. But the question we have here is, what are some after Dr. Swick talking about the impact of stress and the negative impacts? Like, what are some negative impacts that stress causes on uh, physical and behavioral wellness in your communities that you could think of when thinking about this?
Just as a reminder, staff from the CUI should not participate in the polling.
Thank you. And I see we got some folks are typing in the chat and others might be working on the poll. So it looked like Megan wrote in alcohol and drug use. Yeah, and that's definitely some important consequences. And I see lack of employment. Folks might still be trying to do polls. So I see that we're waiting for some responses there. I see poor interpersonal relationships. Definitely. That's a big one that suffers when we're stressed out. It's like sometimes we take it out on strangers sometimes and the people that we're closest to. It's really interesting. Oh, I see. Yep. Family abuse and neglect. People seem like they're liking to use the chat here. Yeah, we've got increase in domestic violence, lack of motivation to engage in programming, abuse and neglect, lashing out. Yeah, so you guys are really right. We're seeing like a whole range. It can be some things that are more minor up to some things that are really serious. Oh yes, this is a good COVID specific one. Someone said constant worry about infecting our elders. Great. And you guys can keep, feel free if you didn't get a respond and you still have some ideas, keep typing them into the chat because we all get to learn and see from each other. While we're working on kind of getting the polling to work and folks are continuing to answer, we can go ahead and pull up the next slide too. Great. So we've thought a little bit about, I do see the answers still coming in. So thank you guys for still answering that. We've talked a little bit about why is it important to recognize stress, right? And so we know that half the battle is being self-aware. I don't know if you guys have ever been in that situation, but sometimes I think I'm handling my stress okay, or our teens or our kids think they're handling it okay, and then someone will say something to them like, "Oh, you seem like not yourself today," or "You seem really stressed out," and you're kind of like, "Oh," kind of caught off guard, and then you kind of look at yourself and you're like, "Oh, maybe I am acting different, or maybe I'm not being as patient." And so we're often not as aware as we think we are of our stress. And so if we do a better job thinking about it ahead of time too, we can be proactive, right? So we can kind of head it off maybe before it comes. So if I know that, some of these are warning signs for me where maybe I'm like eating more or sleeping more and withdrawing from my friends, if I see myself starting to do those things, then hopefully, or we see our youth starting to do those things, we can hopefully help raise their awareness and have them start using skills before their stress level gets so high. So that's why it's important that we try before jumping into the skills, we really raise awareness about recognizing our own stress levels. And it's kind of a lifelong journey. Some days we're better at it than others. And I think that's important to share with our youth too, that even us as adults, we struggle with this as well. Next slide. So now we're going to transition and talk a little bit more about the negative impacts of stress. Next slide, Mindy. Thank you. So we can think about, and can be for us or for our young people, because some of our young people are the age where they are, out in the workforce. Is that stress can impact our work. So first of all, we can over-identify those we are trying to help, and we might think to ourselves, is that a bad thing or is that a good thing? And it's when we over-identify, it's bad because sometimes then we can't kind of leave our work at home. Our own like health is wrapped in like the health of those we're helping, and we can't kind of separate like our work life and our home life. And sometimes when we can't have those boundaries, that can really make it hard to de-stress from our work. We can, at the same time, where we're over identifying, we can, at the opposite end, we can withdraw and even get angry at our coworkers or those that we are trying to help. So we can kind of see both extremes, that extreme where we're trying to like do anything and everything for that person and our life is wrapped up, to totally withdrawing and getting angry. These are signs that stress is really impacting, our work or our school life. In addition, we experience burnout. And I think with COVID, some level of burnout, unfortunately, has become normal, but we don't have to accept it. It doesn't mean we shouldn't engage in self-care. And then the other thing that can happen is we get vicarious traumatic stress. And some folks refer to this as compassion fatigue. So if our young people, or we are helping people all the time that are experiencing really traumatic things like suicide, hearing those stories can traumatize us, even though it hasn't happened to us directly. We, as the helpers, having to hear these stories, or if our young people are hearing these stories all the time, they can get this sort of like secondary traumatic stress. So again, these are just some examples of ways that stress can impact our work. And we do have a poll question here, and I'll let Sabu let us know whether we're going to try the polling thing again or type in the chat. He'll direct you guys there.
Thank you, Dr. Swick, and I think we'll hopefully able to do this again. I have it up, and I was working on the back end. The polls did work. I did see responses. I just making, hopefully this time around they work. I put the link in again. Please, when y'all press on the link, there should be a question that pops up that asks this question up right here: what stresses are specific? And so if you do see that, please text in the chat box that you did and you submitted your response. Once you do so at least we know, because on my end everything looks good. So the link is there. The question is, what stressors are specific or unique to home visiting or being a caregiver, like in your own communities, and seeing if and typing it into the link that was provided.
Great. I see Elizabeth typed in compassion fatigue, burnout, secondary stress. Yes, for sure. And again, these are so important because if we're the ones all on this call, helping the youth in our communities, we've got to take care of ourselves, right, to be able to help them. And then this can also apply to some of our youth as well. So thanks, Elizabeth, for typing that in.
So it's working on my end. Mindy, can I share my screen? I don't know why it's not sharing it on yours, but I could share it on mine.
Sabu's seen all your wonderful answers, so he's going to share them. Time constraints. Yep, that's a good one. I saw someone. Oh, I like it. Here we go. Yes, being overwhelmed. We are. I mean, everybody was probably already a little overwhelmed even before COVID. And now it's just our caregiving responsibilities are double, triple, quadruple. Lack of communication. Yeah, that's definitely a big one. Doing a lot of Zoom. Yeah, trying to do like one-on-one or therapy through Zoom and being on Zoom all the time. Yep. Trying to kind of balance caring for your family, caring for work, and maybe not feeling like you have the skills needed. Yeah, you guys have some really powerful, touching answers here. Thank you guys for these responses. Thanks, Sabu, for sharing. I think this is working well. Lack of appreciation, I see. Yeah, and it's hard because it feels like sometimes like we're all going through the same things that we don't want to complain, but yet we do, complain. Some level of complaining feels good, right? And then we all need some appreciation. I see low frustration tolerance. Yes, I feel like I've noticed that in myself and others. That's a big one. Wonderful. Thank you guys so much. Sabu and Mindy, maybe we can go to the next slide. These answers are really great. And maybe there's a way to kind of compile all of these because you guys have put such powerful things in. So what we're hoping to, emphasize for you guys as caregivers, for the caregivers in your community, and for youth is trying to have kind of this balance in our life, whether it's work-life balance, school life balance, like we all have different domains. And we know before COVID, 24% of people said it's hard to not think about work, or in this case, we could think about school, like in your free time. And I bet it's a lot higher now. And the reason why it's important to kind of have this balance, I think we all sort of know it, but we just need reminding of it, and we all need to do it and be role models for ourselves and, for our youth in our community. Is that when we have balance, we actually can be more effective in our positions. So there's actually studies that show this, and increases our individual productivity, our team productivity. It strengthens like our work relationships, and it allows us to be better for the people we work with when we actually like don't check email 24 hours a day, right? And we actually like take time off. There's data that shows this. Next slide, Mindy. So how stress impacts our behavioral wellness. And, I could have done a whole talk on this, but we really want to, again, get to kind of some additional skills. But we all know that when stress becomes overwhelming and prolonged, and again, it's different for each of us, the risk for mental health problems increases. And that could be even in folks who were relatively healthy before, or folks who already had pre-existing mental health concerns and then have the stress amplified on top of this. And in particular, this long-term stress has really been associated with trouble with anxiety disorders, depression, substance use. Sleep is a big one that we really need to tune into, and suicide. And you may wonder kind of why I have suicide starred here. And part of the reason is there's actually mixed data coming out about COVID and suicide. And I don't think we actually understand it all yet. There's some studies that are showing that there's decreases in suicide rates during COVID. But we are seeing that's different in different populations. A recent study came out, showed that among Black individuals, it seemed like there was an increase in suicide during COVID. So that's the reason I put a star here. I think on a one-on-one level, there is that increased risk, but I think on a national level, we're still trying to understand the impact of COVID on suicide. Next slide, please. The other thing we really want to recognize too is COVID's role in ongoing oppression and historical trauma for our Indigenous peoples here. And so again, I have some definitions here, and I'm not going to necessarily read all of these to you, but you guys are going to have those for your reference. But part of historical trauma in its earliest roots was intentional and unintentional spread of disease. And so this COVID currently can really remind and bring up, whether it's subconsciously or consciously for our Native people, that old historical trauma, and it really relates. And it's really important because I think a lot of other non-Native populations don't understand this for our Native peoples, and it's really important. So I wanted to highlight this here. And my colleague, Dr. Victoria O'Keefe, has really done a lot of great presentations and focus on this. You can also look at her work. And we know that historical trauma, whether it's the impacts of COVID now or past impacts, is associated also with depression, anxiety, substance use, and suicide. There's some studies showing that link. Next slide, please. So now we're going to talk about how stress is, again, we started to talk about it a little bit, but continue to talk about how stress intensifies, is intensified by COVID in Native communities. Next slide, Mindy. So how does it specifically, so we know that COVID is impacting our Native communities in many ways, but these slides are kind of really focused on the behavioral wellness piece. And so we know that ongoing care for folks who already had mental health or substance use issues became really challenging during COVID, right? So maybe you couldn't go, maybe the behavioral health clinics were closed, or you could only do telehealth visits. You might not have had access to ceremonies that were healing. And so that's one big way that COVID has impacted mental health. And again, then we also have folks who are coming up with new mental health issues who also can't get those services. In addition, COVID has brought a lot of grief burden. Grief burden has already been high among our Native communities, both urban and rural. And because of COVID, we haven't been able to mourn in the ways we normally do, right? Because of physical distancing and the ways we can and can't allow people to attend services. And at some point, this will come up, right, for us. We might be able to push it off, this grief, but then at some point, it's the young people in our communities are going to have to deal with this and be able to grieve appropriately. So this is really a big impact. Next slide, please. And again, we highlighted this a little bit. These are, it reminds our young people and all of us about past historical traumas. We worry about losing our elders to this disease, and worry about losing, for some of our communities, losing their cultures and languages with those elders. The ceremonies again and community gatherings have really been disrupted. I know at least in some of my communities, they're starting to be able to try to have some of the ceremonies again because they're getting COVID a little bit more under control, but it really impacts mental wellness. And it really is a source of strength and resilience that we haven't been able to tap into. And then we also have to remember our frontline workers and families. So you might think about for the Native youth that you work with, if they themselves are an essential worker or their family members have been essential workers, they also have additional stressful impacts due to that. Next slide, please. So I would love, I think, Sabu, in the interest of time, I think we might, because I've been so engaged in these poll questions, which is fabulous, but maybe we can type this question into the chat. And if folks want to respond to it in the chat, you guys can feel free. And we can also talk about it some at the end, but I want to keep us moving through the slides to make sure we get through some of the skills. Does that sound okay, Sabu? Great, he's giving me the thumbs up. So he'll type it in the chat and then we'll, Mindy will bring up the next slide. But I know you guys are all reading each other's chats, so I really love the interaction here. So the last part of our presentation, and again, we can reflect on the chat at the end, is what are some coping strategies that we can use ourselves and teach our Native youth? So next slide, please, Mindy. So we use this term self-care, right? So interchangeably. And I feel like everything we hear today, it's like, oh, engage in more self-care during COVID. And we could all sit there and think to ourselves, how many times have we told ourselves that and told our kids that and told, our coworkers that, but then do we actually do it, right? And so here's a definition, because it's like we talk about it, but what does it really mean? And so I'm not going to read the definition for you guys, but I highlighted a couple words here that I think are really important, that we really need to have our self-care be deliberate, meaning we kind of need to plan and be purposeful about it. We need to, and again, we need to really choose to engage in it. It's not like, oh, by the way, today I happened to do this, and I guess that was like self-care. We need to really try to do it on a regular basis and maintain it. And it's really supposed to enhance us. So these are some key words when we're thinking about self-care for ourselves and for our young people. Next slide, please.
I just wanted to note we're right at about 10 minutes remaining.
Wonderful. Thank you, Mark. And so again, why is self-care important? It helps minimize the stress that we've been talking about. It helps to prevent burnout. Again, it's not a like one size fits all cure. It helps us to be our best at our work and in our families and our communities. And it also helps us to stay physically healthy. So having this mental health care really also helps our bodies in addition to our minds. One thing I would have you reflect on, we were going to do a poll question, but you should reflect for yourself if you think you spend an average amount of time on self-care above or below. And I would probably ask the young people that you work with similar kinds of questions. Next slide, please. So again, here's some barriers to self-care. This list is not all inclusive, and we could probably think too for our urban youth. They might have some unique barriers to self-care that are not on this list, but it's important to examine what those barriers are. So I would work through with your young people to identify their specific barriers. Next slide, please. Mindy, you can probably scroll through and bring up all the bullets just so we can have them up. Thank you so much. And so this is a way for us, again, to kind of think through actions that we can take. So we can think about with our young people, we want them to be able to try to calm their body when they're stressed, use strategies to clear their mind, and then take other kinds of calming actions. And so we can teach them these skills and have them think about which ones they're already good at, which ones they could try to do more of, and kind of be deliberate and come up with a deliberate self-care plan. And I'm hoping someone's asking if we can share the slides. I'd be happy to have these slides be available to everyone on the call today so you guys can have these for your reference. So we all know letting feelings out and talking is really important. So that's one strategy. We know that exercise is really important for self-care. And we can meet the youth where they are. It's going to be all different kinds of exercise. It can be things from basketball to things like yoga. There's no restrictions on what kind of exercise this is. We also know it's good to rest and relax. So really take time when we're not on our phones, we're not multitasking. We are really just being calm and present in the moment. We can also use techniques number 4, which are called distraction and pleasant activities, right? So during COVID, a lot of us, and we still are today, get really fixated. Like I had a time where I just was watching the news every day, right? And you guys may have had times like this too. And so you couldn't take your mind off like what was happening in the world. And so for me, I had to say, okay, I need to like stop that, because for me, it was not helpful. And you might think about for yourself something similar. So I had to say, what can I do to distract myself so I don't want to watch the news? I need to actually distract myself from thinking about COVID or whatever stressor in your life for a few minutes. So distraction actually can be good. And then we have to kind of engage in pleasant activities. So it's like, instead of watching the news, which is not pleasant for me anymore, I'm going to go outside and take a walk, or I'm going to go plant a garden or work on my garden, right? So that's what we want to encourage youth to think through. Number 5 is try to solve the problem, is definitely another strategy. The thing about this is obviously we're not solving it's not like we can solve the problem of COVID instantly, any of us, but we can look at specific problems in that youth's lives or in our lives and try to use problem solving skills. Here, it's really important to think about there are things that our youth can control, right? And then there are things that they can't control. So problem solving would be a skill we would use when it's a issue we think they have some control over. Next slide, please. So here, there's also these, I just want to make sure you guys are all aware, there's some great mindfulness and meditation apps. Calm's a really good example. We could walk through our youth through meditation exercises, but we can also, we know some of our youth really like using apps and different technologies. So I just wanted to make you aware of that here. Next slide, please. Because we were kind of talking about that. So now we've got the next set of strategies. Again, and these are not going to all work for everyone. Number 6 is related to self-talk, right? So that's those stressful thoughts that go through our mind, trying to have our youth start to pay more attention, like when they're stressed, what they're thinking, and to see if they can try to replace it with some more positive thoughts. We want them to be aware of their negative coping strategies. So for example, if they are drinking more or engaging in other kind of risk-taking or reckless behaviors because of their stress, to try to make a commitment to trying to decrease those strategies and replace it with some of these other strategies that we're talking about. Number 8 is related to boundaries. Just like us as professionals need to be mindful of our boundaries, we need our youth to be aware of their boundaries as well. And then number 9, this one is so important, is have the youth think about if there's any traditional practices or use of prayer that will really help to calm them and ease their stress. And this could even just be as much as spending time with elders. And we know again that these things are harder these days with COVID, but youth are really creative in using technology and other ways to be together. Next slide, please.
We're right at about 5 minutes left.
All right, thanks, Mark. So much good information, so much engagement from you guys today. I love it. So the other thing we want to do is we have some slides, these next set of slides, and I know that the team is going to share these slides with you that are self-care strategies specific to COVID. So I won't read through every single one, but the first idea here is this idea of learning to switch off. We need to all take a mental break from either COVID or our specific stressors. So this has some examples of ways that you can do that, and you can encourage youth to do that. Next slide, please. The other thing that we would really encourage us to do, some of us are working remotely. Our youth could be doing remote school, right? They might not be in college or in school in person. And so they need to learn to take breaks, right? So we need to take breaks from Zoom, take breaks from our work, take breaks from our school day. So again, this has some ideas here of ways that we can encourage ourselves and our young people to do this. Next slide, please. Then the other thing we really want to encourage us to do is to take time off, which I know feels like, it does feel strange here because I feel like there's so much work to do. Can we go anywhere and do things we used to do? But taking time off is still really important, and really using that time to disconnect. And I think that's important for our young people. I know I'm really attached to my phone, and I feel like young people are probably even more attached to their phones. So trying to find that time to connect with nature and people and disconnect from work and school and electronics. Next slide, please. Here we've got some tips for you guys for working remotely. I think in the interest of time, you'll have these for your reference, but we can kind of move on to the next slide. So in summary, I feel like at the end of the presentation, this is a good summary. We want everybody to try to just take a deep breath here. I'm going to do it too. I try to teach my daughter to do it. She's 8. She's not quite caught on yet, but I bet some of you guys are really good. So this is just kind of a nice summary of the skills we talked about. And every person likes different acronyms and different things. So again, we want us to try to be in the moment, be really present. It's really hard for most of us. We want us to set realistic goals for ourselves, right? We're not going to like get rid of all our stress at once or be like super stress-free people. We have to set realistic goals. We want to really notice the positive things in our life every day and really notice them, really tune into that. We want to do more kind things for each other. I think this is really important for our young people too. have them turn around the negatives. Okay, so when they're getting that negative thinking, turn it around. I love this one, H, honor our strengths. These can be our cultural strengths, their individual strengths, really work with our young people on this, and end each day with gratitude, which can be really hard today with COVID. But if we focus on it, we can find little things to be grateful for. So I think we're probably at perfect time to take some questions and some discussion, because we want to make sure to leave time for that. And I saw a really active chat, so I'm so excited to see your guys' participation. So Sabu and others, I'm happy to open it up for questions through the chat, or if folks want to speak up, good too. And here we have prompts if you guys, we have discussion prompts if you need them, but I have a feeling you guys may have lots of thoughts without these.
I just wanted to make the general observation because a lot of comments were in the chat about the availability of slides. And I think it's clear now. Slides will be made available to all of our registrants, as well as links to the recorded session as well. So yes, they'll be available to everyone, just to let everyone know.
Yeah, just to add on, is if there are any questions for Dr. Swick. I know that we went through a lot, so maybe asking questions that you might want to have in regards to like strategies and things that Dr. Swick has seen and has been able to do and see that's been helpful for Native youth, I think is good. But if folks don't have any questions, I mean, these are some really great discussion questions. Just asking like, what are some what are some strategies even amongst one another, right? Like, this is a community of learning. So the aspect of that is also just sharing with one another on like what strategies have been helpful in your own communities as all of you support Native youth who are going through times that has not been able to, I say, be anticipated. So there's a question by Kelly McCall, and she asked, may we reach out to Dr. Skook if we think of questions after reflection?
Definitely. I love it. I love when I do presentations and folks reach out afterwards. So I would be happy to do that. And I will, I see someone asking about mindfulness too, so I'll reflect on that. We'll make sure if my email is not in the presentation, we'll put it in the chat and make sure that you guys have that if you guys want to reach out to me. So Mark is asking kind of to reflect a little bit more on what mindfulness means. And I think the simplest way I can think of to kind of describe what mindfulness means is almost to describe what it's not, right? That's like it's a cheater way, Mark. But what our tendency to do as individuals is we're constantly thinking about what happened yesterday or 5 minutes ago or what we're going to do next. And we're not actually really in the moment of what is happening right now, and really observing that moment and letting ourselves kind of stay in it. That's part of what mindfulness really is. And it can also be quieting our mind, and just kind of seeing what kind of comes through, like what our thoughts and what our feelings are, just kind of letting ourselves be quiet for a little while and be in that present moment. And so I think that's a really great question, Mark. And I see also, oh good, Mark put my email for you guys in the chat. Oh, I love this. So Ricky typed in an answer as well. It is being highly conscious of what emotions are in us, exactly how they got there and how we deal with it. That is great. Tamara also wrote some things that her tribe does, that they're allowing youth to engage in places where they're allowed to go in nature and be with animals and do therapy with horses. And that can be a good way for youth to kind of practice some of these strategies that I listed under calm body and clear mind. And you're really right. Sometimes for our young people, like to just talk about these strategies is they get it, but sometimes to be able to be outside or be doing an activity or doing beadwork. We've also found that for some tribes that we work with, that they can really calm their mind and body and focus on these strategies when they're engaging in something like beadwork or like your equine therapy that you're talking about. It's wonderful. Yeah, so some people do Tanaya, I'm sorry if I'm not pronouncing your name right, is just asking about kind of orienting some of these strategies involving the medicine wheel. Yeah, so I have seen different tribal groups kind of use the medicine wheel or other um, cultural traditions to kind of orient these same strategies. So we've had some folks kind of do things with like the four directions and other tribes as well and kind of orient some of the strategies there. So that's a really great point. If you guys can think about how some of these strategies align with your cultural traditions and ground them there, that's going to make them even more powerful and meaningful to the youth. Great reflection.
Yeah, I would also, I know that we have a youth council, like American Indian Alaska Native youth council, and I remember in their orientation training, one of our former staff who's native from Oklahoma did a clay making like therapy activity as and use the medicine wheel of talking about the directions and what that means for them currently in their future overcoming challenges. And it was really a great way to incorporate our former staff's tribal belief, but then connecting it to other youth from different tribes and what that means to them. So it was a great activity. And I wanna, because we're closing out on this, there will be slides provided and a follow-up email for everyone who is here today. But I wanted to take some time to ask everyone to, if you can, please take the survey that we have. Um, uh, the survey is, sorry, I'm just trying to get it out for all of you. Apologize. Just putting it in the chat box for all of you to have, just to take with you. It takes only a few minutes. It's really just for us to get more feedback from y'all. We want to have more sessions around supporting Native youth and aspects of wellness and helping all of you in other topics that you see that might be helpful in your community. So definitely, if y'all could just take some time, just a few minutes, just to give us just some feedback would be much appreciated. We're here for all of you and making sure that future sessions that we have really focus on your needs and better supporting you to better support the youth that you are all helping. Um, and there's some, I think there's one slide I want to also share with everyone about our upcoming event that if you wanted to share with Native youth in your community, there is a activity with one of our fellows who's Native doing like art therapy. And so it says here ages 16 to 24, but honestly, in our last session, we had like 5-year-old Native youth on there participating. So if you have, uh, kids or nephews or youth that might be helpful, would like to join, it's on creating this one event is on creating touchstones and saying thank you and thinking about ways to use gratitude and build like creating your own like touchstones. So it's going to be really great opportunity for folks. It's happening next week. So I think the registration for materials, if y'all wanted materials, will be closing at the end of this week. So if there is any youth or kids that you might have who are Native youth that would like to participate, just go to the link I had put up here, the SUNY, and I could bring it up again to the SUNY, the Nikui Act, Nikui SUNY site link. It's the registration is there. I put it in here. It's just a great activity and just a great facilitator we have. So I don't want to hold anyone else up. I know we're 2 minutes after, but really appreciate all your time, Dr. Swick. Really, we're honored and appreciative and so much and grateful for your support. And hopefully, maybe in the future, we could work see if any other topics that might be of help to our community members that joined today.
Thank you so much, Dr. Swick. Thank you.
Thank you, everyone. And I typed in the chat that if anybody needs to stay on to process anything, we know sometimes these presentations can bring strong personal reactions in us as individuals. I'm happy to stay on and talk with anyone that might need that. Thank you, everyone, for your great participation too.